Hello and welcome to the Flipside of Adversity, where we dive into the stories, the science, and the strategies behind building resilience, healing, and transformation. If you recall, in May, we actually sat down with Dr. Shonda McManus and we unpacked the science behind this concept called weathering. The long-term impact of systemic stress and discrimination on the bodies of Black women. Now, let's be clear, this isn't just theory. It's actually measurable, it's real, and it's costing lives. Black women are disproportionately affected by complications in pregnancy, childbirth, and chronic illness. Not because of personal choices only, but because of generational strain, bias in healthcare, and the wage and weight of doing it all while being unheard and unseen. So today, we're drawing a line in the sand. It's time for healing and wholeness. It's time to reclaim our health and our power. And most importantly, our peace. Let's lean into this vital conversation and step into a future where wellness is our birthright. So let's begin right here on the flip side of adversity. Trauma, toxic stress, broken habit, and hurting heart don't define destiny. But peace isn't passive. It requires an exchange. To create a flip and access peace in the middle of the pieces, you are challenged to make an exchange of the lies that have kept you mentally hostage in basement moments. Resilience isn't about bouncing back, but bouncing forward. Living Strong, the flip side of adversity, brings powerful stories and fearless conversations from experts in the field of business, relationships, emotional, physical, and mental health, and faith-based communities. Each episode creates a brave space with powerful tools from authentic connections. Tune in as we dig in with Dr. Jackson on the flip side of adversity. Hello. I am so excited about this conversation. And as I shared in the opening monologue, that this is actually, I'm feeling like a continuation of our conversation with Dr. Shonda McManus, who also is a soror, in May, where she unpacked the condition of weathering and how systemic stress and discrimination actually weathers the body of Black women, and it shows up in their health. And so she took us through the science of that and unpacked how her response has been creating a blog every single week called Weatherproof. And she walks Black women through how to weatherproof their health so that the conditions that show up in our body can actually be addressed, better understood, and you can have a different conversation with your doctor. Well, all of that science around weathering happened as they looked at how women, Black women, and pregnancy and their maternal health was different as they got older. And from the birth of that observation and research, this concept of weathering has entered into the medical field. And I have the privilege of having State Rep Gina Curry, who is no stranger to the flip side, actually walk us through powerful work that she is spearheading with her colleagues around being champions for Black maternal health. So welcome to the Flipside again.
Thank you. I appreciate it. I love being here.
And just in case you, by chance, don't know who she is or have not tuned in before, I have just a snippet. This by far does not do justice to all of the powerful things, but just a little bit. State Representative Gina H. Curry is a dedicated public servant, educator, and equity advocate with over 20 years of experience supporting youth and families. Elected to represent Pennsylvania's 164th legislative district, she champions equitable education funding, economic development, and Black maternal health through co-founding the PA Black Maternal Health Caucus. Her background as a consultant, a school board leader, and behavioral health professional underscores her lifelong commitment to social justice and community empowerment. So that's just a snippet of your career. But I actually want to lean in and ask you, why is this work personally important to you?
First of all, I want to say thank you to the Flipside and Dr. Vietra Jackson, who is my sister. Thank you for having me on again. And thank you for highlighting such an important issue that most people don't really know about until they've had an experience or known somebody who's had an experience. And I think that's why it's so important to me to get the word out about the really disparaging numbers that are out here in the Commonwealth of Pennsylvania, and that it's going to take all of us to make sure that we change the narrative around Black women and birthing people who die 2 to 3 times higher in Pennsylvania and 3 to 4 across the nation. And so when folks hear those numbers, what's going on? What's wrong? And so I actually get chills. And I've been doing this, since the top of 2023 on this specific issue.
Right.
And when I talk about it, every time I get chills because I think, wow, there's a demographic, which is my demographic. And I've had 3 children, praise God. But we've all had maybe some experiences that we might not be able to vocalize. And now it's becoming a normalized situation to vocalize the experiences.
Right.
But I will tell you, Doc, everybody doesn't get to vocalize it. Women die. Black women die on their birthing journey. Black birthing people and families suffer.
Yes. Yes. So in my opening monologue, I mentioned how this is actually an opportunity for us to talk openly, but to also recognize that there is power in our voice. And when we are on a journey of really better understanding and then equipping people to recognize that this isn't just an anomaly, but this is actually reality. What do you want our listeners to really understand at the core of this conversation?
I want our listeners to know that they have a voice. Oftentimes in our communities where things are happening to us, we don't know how to actually work to push it back off of us. It just happens to us. And so, we are highlighting and really making this come to the forefront because we want folks to know whether you are doing this work as a grassroots advocate, an activist, or just somebody who has a family that your concern is there, has the ability to speak up, speak out, and really advocate at the state and local levels for things like hospital closures, for things like maternity deserts, which means there's no hospital within range of a certain amount of mileage. And so, what I want people to know is to hear the information and then don't sit on it, but to actually act.
Yes. So you have been, as you said, working on actual solutions, opportunities, access since 2023.
Yeah, really 2022 when I think about it.
Yeah.
Because I got a phone call. I had just been sworn in that January, and I got a phone call from Delaware County Memorial Hospital, labor and delivery unit. It was a message left on my phone. And the nurse there said, "Hi, I'm an L&D nurse, which is labor and delivery. And you don't know me, I don't know you, Rep. Curry, but our labor and delivery unit here at Delaware County Memorial Hospital is closing on January 29th. That will be the last time our doors are open for mamas to come in and have babies." And so I listened to that message, Doc, and I was like, oh my goodness, what is happening? And as I began to dig, I had a policy hearing, my very first one, over at Bonner Prendy. I remember it clearly, and brought the grassroots folks together to say, what is happening? This is becoming a maternal desert. And it did. And guess what? That hospital closed at the end of 2022.
Wow.
Yeah.
When I think of lack of access, and the numbers that you are sharing in disproportionality, when you talk about Black Maternal Health Caucus in Pennsylvania, what is happening within that movement?
So just briefly, the PA Black Maternal Health Caucus was co-founded by myself, Representative Morgan Cephas, and Representative Latasha D. Mays, who's out in Allegheny County. Morgan Cephas is in Philadelphia, and I'm in Delaware County. We are the trifecta, we call ourselves, and we are all sorors of Delta Sigma Theta, Sorority Incorporated. And so we are doing that work because we know that it's so important. And I must say, Representative Cephas, we call her our old head. She's not. She is probably the youngest, but her wisdom and her ability to do the work early on in her career around maternal health and maternal morbidity and mortality rates, because she actually had a young woman, Shayna, who perished, who lived in her district, having her, I think, third baby. Professional woman, they try to put numbers on us like it's women that are in poverty, and it's not true. We have a list of women who we know that, Kira Johnson is one of them, whose husband came and joined us this April in Pittsburgh at our Black Maternal Health Summit that we had. Charles has been fighting the fight to make folks know, don't put it in a box. It is Black women. It's Black women who are professional, who are degreed, and it is Black women who don't have access. It is all of us who are suffering. And so we came together and we were like, the numbers are crazy. I think Representative Cephas' sister had just had a baby during COVID. Latasha became a mom with her partner. And of course, I have 3 kids. And we were like, this is an issue.
Right.
And I know for me, I'm finished having kids. My youngest is 15, but I'm thinking about my next stage, grandchildren.
Right.
I want to make sure my daughters and even my son, whoever he connects with, that they are fine when it comes to birthing children.
Yes. So you also touched on a point from the monologue. I shared how this isn't just an individual person's issue, and it's not an individual person's fault. And so as I literally spent today getting recertified in Bridges Out of Poverty, and how in that conversation, sometimes we, if we have not lived or experienced the same experiences as another person or a group of people, we can sometimes come to the conversation with an assumption, and somehow that person didn't do what they were supposed to do.
Yeah.
And in the monologue, I shared that that's not the case here.
No.
Can you unpack that a little bit for us?
Yeah, that's been a huge issue, particularly in the legislature, when we're trying to get bills passed or legislation passed. We've had folks make some real interesting comments to us about, well, why are we just talking about Black women? Why is it about Black maternal health? And what's the deal? Why are they the ones who are dying? And so that puts a stigma again on what it might be. And I simply look at it as the fact that there's an issue if there is a demographic that's dying at higher rates. And we want to say 2 to 3 times higher.
Right.
And that we know too, let me say this, Vitra, we know too that 93.5% of these deaths are preventable. Let me say that again. 93.5% of these deaths are preventable. I remember the first time my wonderful sister, who I went to St. Joseph's University with, we've reconnected since then. She's an amazing OBGYN out in Lancaster. And when she gave us that statistic, I was like, tell me more, Dr. Livingston, tell me more.
Right. I'm sitting here. I had no idea. What? So what are the factors that are behind that number?
So, you know, for me, I come from a perspective, and I have a great friend who does a lot of work in health equity. I'm going to shout her out, Gina Johns from Once Upon a Preemie. We've talked about health equity for years. I knew her even before I went into, when I was doing my own consultant work, and met her, and she's been doing this work for years. And she has Once Upon a Preemie because it's a NICU. She works with preemies because her son was born. He was a micro preemie, I believe, which means they're under a pound or under like 1.5. Yeah, something like that. So it was very small. And she talked about the bias, the implicit bias that, as being one of the only Black women in the NICU at the time, she felt like she wasn't being given the same treatment or the respect at that time. And she didn't want that to happen for other mothers. So when we go back to say they're 93.5% are preventable, there's things that we really have to break down and look at. We know that oftentimes, and this isn't a comfortable conversation.
And I know some people are, and why I wanted to lean into this moment is because I know when I posted this, people were like, well, why are we talking about Black maternal health? Shouldn't we be talking about all maternal health? Well, no, because this is actually an issue.
Right.
And so I know it may be uncomfortable, but we actually have to lean into it in order to understand it. So break it down for us.
Yeah, so I'm so proud of the trifecta of Rep Cephas and Rep Mays, because literally every time we get up to the mic, we talk about this on the floor, in committee, with our colleagues, and we will literally have back of the house conversations about what this looks like. Yes, Black maternal health is being talked about and emphasized because our moms are dying 40% higher. So when you think about the 93.5% that can be preventable, how can you look and say, why are we talking about Black moms? Yes, this is about maternal health. If we can get the numbers, we're still waiting on that maternal mortality report from the state. I am anxiously awaiting to see how many women died last year in this process. We know there's many factors. That's why we've extended Medicaid
Mm-hmm.
from, 0 to 12 to up to a year,
Mm-hmm.
because we know that women die after giving birth.
Mm-hmm.
Women in birth and people die afterwards. There's issues something that we talk about most often now is substance use disorders, SUD, for women who are having difficulties in that area. But again, you talk about blame. Those are the stigmas that we have to take down. We talk about the fact that social determinants of health and lack of access, housing, food insecurity, utility insecurity, all of the factors that have to come into play so that moms and birthing folks can bring forth babies that are happy, whole, and healthy. And these are things that we absolutely have to pay attention to.
Yes. And you actually have begun to identify bills, responses, legislation to address it. Can you walk us through some of the ways that the trifecta are responding to this very real issue?
Yeah, sure. I get so excited when I talk about what this looks like. So last October, we founded the Black Maternal Health Caucus in I believe April of that year for Black Maternal Health Week. We had a big thing in 2023. And then in October, we put together the Momnibus 1.0. So the Momnibus 1.0 was like great. We had 8 bills that we introduced. I called them 8 great bills. We had a lot of people come and converge on Harrisburg for the Capitol, like opening of the Momnibus 1.0. We were able to get 2 bills across the governor's desk.
Oh.
Yes, 2 bills, which is more than the national Momnibus, which there's a federal Momnibus that Alma Adams and Representative, Lauren Underwood, glad I remembered, giving them much respect for the work that they've done in the federal government around their Momnibus. But they, unfortunately, haven't really been able to move those bills quite the same. We got 2 across Pennsylvania's governor's desk. And we're really proud of that. And one of them was to provide Medicaid coverage for doulas. And for those of you out there that don't know what a doula is an amazing being who's trained. We have doulas and doulos because there are men who are really involved in this process now too. And you can get a doula when you first find out about giving birth all the way up to the postpartum era. So from 0 to 12, doulas are now reimbursed through Medicaid. So we are just hoping, and I'm praying, that we can keep our Medicaid system in place so that we can continue this coverage, because it's so important for moms and dads and partners in those rooms to be able to have an advocate, somebody to step up to say, wait a minute, my client or my patient or my mom here is having some difficulty. How can we work to help her out? How can we work to help dad out? So that was one that was amazing. And that was Rep. Cephas that brought that forward. And then the second bill, well, it was really the first bill. It was around postpartum screenings. And so the governor this year in his proposed budget address actually made that a priority. And so we were super happy because we got so much pushback about this particular bill because of the fact that there's not enough mental health providers. And so, working on the legislation, we're like, what are you talking about? We need this. But that bill ultimately was passed and signed into law. And what it does is it's an education bill now to share with moms what they need to do if they're experiencing this, but not the exact screening. So Representative Liz Fiedler, myself, and Representative Lisa Borowski, we co-primed that bill. And Representative Fiedler, she just had twin girls, identical twin girls. she is actually working on getting more legislation across so that these screenings can actually take place.
Yes.
It's one thing to be educated about it. It's another thing to have the actual screening so that folks can be able to identify it. And so that was Momnibus 1.0. But I'm happy to announce this Monday, June 16th, we will be having Momnibus Day at the Capitol in Harrisburg, and we will be introducing Momnibus 2.0.
Wow.
Yes.
And tell us, give us the details.
So Momnibus 2.0 is not negating Momnibus 1.0. We're still working on that legislation, and legislation is being reintroduced because there's a lot of things that we have to work on. But what I'm so excited about that most people do not know is that when you have a caucus, people don't know what a caucus is, right? So we have a grassroots section to our caucus, which is our community engagement portion, where we work with grassroots organizations, many of them in Philadelphia, Central, out West, all of these grassroots, and I can't name all of them because I don't want to get in trouble.
Right.
Because there's so many wonderful ones and so much great work being done. And so, but these grassroots orgs with these advocates and the folks that work so hard every day, they can't be a part of the caucus per se. It's members. So you have to be a member of the House of Representatives or a member of the Senate, and then you can join a caucus. And so what we do as members is we're tapped into our caucuses. And what I can announce about, not to give all the secrets out, but announce about Momnibus 2.0 is that we have now an additional 4 members who have brought forth additional bills. So we had Fiedler and Borowski, and we had a few more last time. Now we have more members who are jumping on the bus, the Momnibus, which we actually have a physical Momnibus that's riding around Allegheny County.
I saw a picture.
Yes, that we unveiled during the summit back in April, and Representative Mays was beside herself because she was able to get that done with her mass transit system out there. And it is riding around in her district right now, I think until the mid part of the summer. And that bus is amazing. You can go find it on PA, Black Maternal Health. And you can follow us on Instagram and Facebook to actually see the Momnibus, those pictures.
So it sounds like more and more members, as well as those who are allies, are gaining momentum in understanding the significance of this conversation. Because I'm a strong believer that if any part of us is not well, it is going to affect the whole.
Right.
And so as we collaborate, as we identify allies, as more are added to this conversation, if I am a mom or a mother to be, what are you hoping I gain in understanding and experience from this process?
So, I just want to say really quickly, I know Father's Day is coming up, right?
Yes.
And so the dads are so important to this space. And so when we had our summit, we actually had a father's panel that was put on by my dear friend who's he is the chairman of the Allegheny County Caucus. His name is Representative Ariane Abney, and he has a bill that's coming out that's centered around, it's him and Representative Cephas, that's centered around the Federal Act. And it's called the PA Dads Matter Act. And that's House Bill 1212. And so happy Father's Day. We are excited about this act because it recognizes the importance of fathers in this space. And so when we go back to what you just asked me, I think it's important when you're preparing and getting ready and knowing even ahead of time before conceptions even happen, because there are people who plan out here.
Yes.
It's important for us to understand how important our health is. I mean, you talked about the weathering with your other guest, which I'm so curious, and I'm going to go back and listen to that. But knowing that we have to take great care of ourselves because we are our biggest advocates. We are our biggest cheerleaders. And we have to come together and around each other. But it's really important. That's why some of the advocates, some of the local leaders, you're starting to see now, we have things that are community baby showers where we come together with sponsors, with different healthcare systems to come together to provide resources and different programs for moms to be and birthing folks who don't know what's happening to them, don't know where to turn, don't know what to look for or how to make it work afterwards. I talked clearly about postpartum depression and disorders. There's many things that happen on this birthing journey. And so postpartum depression is real.
Yeah.
Some people experience postpartum psychosis. So these are things that when you go back, if you're feeling pain, we know that some of the moms who have passed away, they have experienced symptoms
and ignored them.
And they were ignored. I want to call him a friend now, Omari, whose wife, the movie or the documentary that was made around his partner's experience and how she died after she had given birth. She couldn't breathe. And I'm going to say this, that implicit bias is real. He talked about how it's called Aftershock. So I want people to go and look for that. It's on Hulu and you can Google it and find it, but it was centered around two men who lost their partners. And they are doing the work to help people to understand, but most importantly, his partner, and I'm sorry, I can't think of her name and I want to name her, but Aftershock is the documentary. But he talks about how when the ambulance got there, they asked her several times, is she on any drugs? Is she a drug user? He's like, no, she just had a baby a couple days ago. She's experiencing difficulties. She can't breathe. Again, another first responder gets there. Is she a drug user? Is she taking any drugs? And so when he tells his story, it makes me shudder because he was like, she just had a baby. And she got to that hospital.
That's not what this is.
Late. And because they didn't get to her in time, it could have been prevented. She could still be here with us today with her beautiful daughter and her baby boy who never got to know his mom. And so these are the stories, the heartbreaking stories that we continue to hear. And so getting moms prepared is our thing. We got to do it. Blood pressure cuffs, both through Medicaid and private insurance. It passed in the House the other day. Private insurance, blood pressure cuffs. So when moms are home, they're not experiencing a post-eclampsia or pre-eclampsia, which we know is, that high blood pressure that goes up. You might be a mom or a birthing person who never had high blood pressure, but during pregnancy it happens. We want to provide moms with baby kits so that they can have the necessary tools to make sure that they're doing okay before and after birth. So, yeah.
So I'm hearing a lot of elements around taking care of themselves, as well as understanding how it is an opportunity to be in community, to also be able to advocate for yourself, know what to advocate for. I remember when Dr. Shonda McManus was on the show and she was explaining weathering. One of her key elements as a physician is she operates from narrative medicine. So narrative medicine is this concept where the doctor actually listens to the story of the patient and uses the story to actually provide the treatment, and that it's not just what I'm the doctor, come in. And so she's a huge advocate around narrative medicine. And so I'm hearing so many connections and threads to her conversation and this conversation.
Yeah.
It's huge.
Yeah, I actually had my intern a couple summers ago. She studied narrative medicine. And I
had never heard of it
until
she...
Shout out to Christina, Tina Kingsbury. She was my intern, and that's what she was studying. So it's an amazing new innovative way to I think cut down the implicit bias that we see so much in the medical field. And it came to mind. Shimoni Gibson, I think, was the mom who passed. Yes. That aftershock was written for her story. And so we don't want to repeat those stories. And that's why her partner is out there doing the hard work, talking about it every day. Same with Charles Johnson, and same with so many other men. Moms for Kira, I think, is his. I mean, there's so many ways that we need to get this word out, because those women cannot die in vain.
I love the fact that you're saying their names.
Yes.
So that their name fills this space. They are remembered, and we're actually actively providing the opportunity for, although a loss we would never want to have happened, it is going to impact others for the positive.
Yeah.
So your desire to impact other human beings didn't just start with this. I think about your background in education and behavioral health. How have those experiences actually also shaped you to be such a fire advocate around systems of change and equity?
I'll be honest, I don't want to put this out here this way, but I stay frustrated. So it fuels. I'm just being transparent. So it fuels me, because when I look at systems, I know how many are broken. And I will say, I know how many are broken through zip codes.
Yes.
Say that again.
Yes.
I know how many systems are broken through zip codes. I know that if we continue to perpetuate poverty, we will never change these narratives. And so we're working hard. My experience as a school board director, fighting in my own neighborhoods on fair funding for education, public school education, for making sure that schools in the Commonwealth of Pennsylvania were understanding that these districts, we have over 500 districts, over 67 counties, in the Commonwealth, and knowing that all of them are not equitably taken care of. These are our kids. These are our young minds who were preparing to have a future. And so when I go to I've been to lots of different places in my experiences now over the last 4 years. This is my 4th budget. So excited. Time really moves. But thinking about my experience as a behavior, it always comes back. Because really in our offices as state reps, as electeds, we are doing the work of the people, social work almost every day, because people come in very frustrated and they don't know where to turn. So our work is about getting into the trenches with our folks and remembering where people really are, the disparities, the real life stories, the loss, the grief, the things that people deal with on a regular basis. And those experiences I'm grateful for, even though, like I shared with you the last time I was here, the pain often is the fuel. And so I want to get to a point where that's not the case, but many stories are to be told around the experiences that people have on a daily basis.
What are the barriers that are standing in front of you, or what are the barriers that occupy space in your mind right now?
That I can't do it all. I just actually had a victory this week with House Bill 433 that turned into Senate Bill 88, which helps women get diagnostic breast screenings. And so I'm really hoping that this bill passes the Senate and comes back down to the House, or whichever direction it's going to go, whether it's my bill in the House or Senate Bill 88. We know that women need to be protected, and men. I'm going to shout out, there's men who get breast cancer as well, and they need those screenings to be able to help. And when I say I can't do it all, I'm one Gina H. Curry. We need people to stand in the gap. Like I tell people all the time, I'm a lawmaker, but I'm so entrenched in the community.
Right.
So when I hear stories, when I'm in folks' living rooms, we had an awful situation happen in Upper Darby a few weeks ago of a young 16-year-old who was shot and killed. When we talk about gun control, when we talk about SNAP benefits being siphoned out of people's accounts the moment that they come in, we talk about food insecurity where the shelves are bare in our food pantries weekly now. We talk about housing insecurity and folks that are unhoused. These are things that as a community person who lives in a community that shares these things, but not only in my community, I tell people all the time, I was elected in the 164th, but I'm responsible for the entire Commonwealth to make decisions, to make sure people are getting what they need.
Yeah. As I started out this conversation at the beginning of 2025, an element that I've been saying over and over again, if we're going to navigate, survive, heal, stay strong in this journey, it is going to be because we actually are seeing one another as human beings. And we are actually working from a place of authentic community.
Yeah.
And that isolation, that pointing of fingers is going to be the death of us. It's actually going to be caring about all of us so that we are all well. What role does community voice and storytelling, you've been alluding to it, what role do you feel that plays in actually building public and political health equity?
That's a great question. Last week, one of my school districts, the William Penn School District, I also represent Upper Darby School District, but William Penn School District was a part of the lawsuit against the state of Pennsylvania, which my husband actually testified in that case, and we won. The school districts won. There was a judge who said, yes, you're correct. Pennsylvania is underfunding its schools. So we've been working really hard. I was blessed. The speaker assigned me to be the chairwoman for the K through 12 subcommittee on my education committee in the House. And one of the things that we're fighting really hard for is to make sure these schools get the adequacy funds that they need. But we know the stories are really important. So as we're in budget season right now. We're supposed to get a budget done by June 30th, but we are always, really up to the deadline or over it. And one of the things that we had was a press conference out front of Penwood High School, which is a special place for me. And what we did is those students spoke. Yes. They told their stories about how this is important that they're funded and that their zip code should not mandate what they get. The loss of athletics, the loss or the cuts of arts and music, which is the reason why some kids get out of bed to get to school.
Right.
They're not extracurriculars. They're essentials.
Mm-hmm.
And so we know that the voice and the stories are so important. In my job, when I'm up in Harrisburg, that is what happens on a daily basis. If you ever get a chance to come up to the Capitol and be in Harrisburg, you see the many groups who are knocking on legislator doors to tell their story, to share what's happening, to help us to understand this is our plight and we need you to help us.
Yeah. You are telling us that our power is in our voice.
Absolutely.
And don't underestimate sharing your story with decision makers. Because I'm again, a strong believer that you can dismiss a statistic, but you can't dismiss a human being who is standing in front of you, sharing their story. We are humans.
Yes.
And going beyond numbers, each individual, just as you have shared the names of each individual woman, it's recognizing as human beings, we have power in our voice. Don't underestimate sharing your story.
Don't be silent.
Don't be silent. As I shared at the top with the monologue, this is an opportunity for us to take power back, to use our voice, and to activate our peace. How do you tap into your peace with all of this? How do you balance it all?
The balance for me right now is tricky.
Okay. That's true.
I'm grateful. I'm a woman of faith. I love the Lord. I know that He carries me every day for a purpose that sometimes I wake up in the morning and I'm like, okay, what you got for me today? Because amen.
Yes.
Still raising a teenager, the loss of a husband, the work that is critically important in our communities, facing spaces that are very uncomfortable on most days. The balance is something that has to be intentional. Rest, hydration, exercise, those that I'm probably not getting a high score in at the moment, but have full intention. I know my future trainer is a friend of mine on Facebook, and he might see this. So he knows that I'm coming. I had an injury to my hand earlier in the year, so I could not lift anything. So I told him when I'm healed, I'm coming back, and I have been cleared. So there are things that I have to be intentional about. And really, Dr. V, breathing, deep breathing at every moment, because we are shallow breathers, especially women. Making sure we're breathing, being intentional with saying no, being intentional with knowing you can't get to everything, and being intentional with surrounding yourself with folks who will help you to understand that you're not alone.
Yes.
And that is so important. We need each other. We need each other.
And that literally brings me back to the top of our conversation. The moment you said, you're not alone, I feel like when we're talking about championing this conversation, this movement of Black maternal health, helping women understand you are not alone. Your voice has power. There are those who are on the front lines fighting for you. But don't ignore or dismiss how you are feeling, what you are experiencing, and identify the community that will support, hear, provide for, and work with you. You are not alone. Wow. As we kind of close out this conversation, how can listeners, whether they are healthcare workers, they're educators, they're partners, what do you want them to understand about this movement, and how can they be a support to solutions?
Yeah, I just want to name like all the grassroots
Mhm.
orgs, especially the Black women who have come to the forefront to make this their life's work. There are so many. And like I said, I don't want to start calling them out, but you
Mhm.
know who you are. We got mad love for you. And, the diaper drives. Like I was at Cradles to Crayons today,
Uh-huh.
that the state was able to get a line item for them for funding. And that CEO there and her team's amazing. They were able to give away 600,000 diapers
Wow.
today.
Wow.
600,000 to many organizations who drove up. We're throwing the boxes in the
Mhm,
thing and they're
mhm.
going back to distribute.
Yes.
I mean, I think about all the organizations around food, insecurities, housing, that's clothing insecurity. So many. And I think I want to name them because they are the reason why we're fueled to not only support them through funding,
Mhm.
but to actually have groups of folks knowing that we're trying to get legislation and policy passed.
Mhm.
I have to also name the Department of Health, Dr. Bogan, and the Department um, of Human Services, Dr. Arkush, and the Department of Alcohol, Drug and Alcohol, our soror,
Mhm.
who is doing that work so dedicated and so committed to making sure that policy moves through. And so these three secretaries understand the assignment.
Mhm.
These three secretaries know that in the state of Pennsylvania, we have work to do. We can't just keep getting these numbers. When we look at, there's many departments, and I don't want to leave them out, but these three departments are working ferociously hard. The insurance department, all of them, because all of them are connected.
Right.
Right. When we
Right.
were in appropriations and we had to, two of us, the trifecta are on appropriations now. And when we had to, each of those orgs those departments came up, and every time we're like, okay, how are we questioning them about Black maternal health, transportation, insurance, all of them, corrections, all of these departments can connect and make sure we're working for moms.
And so, as an everyday person, is there a central link, location that I can support or get connected to some of these grassroots organizations? Is there a central location that I can go to get informed of how or what they are doing? You've shared this. I'm energized. You've shared numbers that have me activated. I'm like, this can't continue. I want to do something to support. Where could I go to begin to understand who are the grassroots?
For sure. So I also want to just name Secretary Latika Davis Jones. That's our soror. I couldn't, my brain, I was like thinking about too much, but she's the Department of, she runs the Department of Drug and Alcohol. So go to these department websites, go visit and see what Secretary Davis Jones is doing. Visit and see what Secretary Dr. Arkush is doing. And Secretary Bogan, Dr. Bogan, their department websites show a lot of what's going on. And then outside of that, come to the PA Black Maternal Health Caucus website. Come see us. Follow us on Instagram. Follow us to see what's happening, because we have a lot of data and information that we put out on our stories constantly, on our website, on IG. We are giving information, statistics, helping folks to understand what is really going on. And, with our healthcare systems literally crumbling around us throughout the Commonwealth, we have big problems ahead that we need help to make sure that we don't, see another healthcare system like we saw in Delaware County, where I am, crash and leave a huge desert for all medical care and behavioral health, but specifically for our moms who are having babies, where are we going to have babies if we can't depend on our health care? We need to bring these babies forward happy, healthy, and whole.
Yes.
And that's what we need. We need you all to help us to understand what's happening on the street.
And so just as we close, share that website again, and then how can people follow you? They're like, she's fire. I want to be able to know what she's doing. So give us the website, and then how can they follow you?
And so the website is www.pablackmaternalhealthcaucus.org, I believe. And then follow us on IG and follow the reps. Rep Gina Curry, Rep Latasha D. Mays, and Rep Morgan Cephas. And you will see the work that we're doing as state reps, and you will see the work that we're doing within the Commonwealth and throughout the nation, quite frankly, because we're trying to pull these caucuses in other states together to be a force to get these numbers down, because that's our main goal. We can have Momnibus Day. We can have celebrations, a summit, all the big things. But if moms are still dying, moms and birthing people can't go in and have babies the way they need to, midwives don't get what they need to perform their duties, physicians don't get what they need to get what they need to help babies to come through, doulas, the gamut, then we're in trouble. Right. Women will continue to die.
My closing question was going to be, what's your hope for the future of Black maternal health in Pennsylvania? But I think you said it, that women are not continuing to die.
No.
Because you shared
93.5% preventable.
Were preventable.
My daughter, your daughter.
Right.
We need to be able to make sure that they, because they're Black women, that they're not going to suffer the thought, if I go in, I might not come back out.
Wow. This month, June, is one in which I have dedicated it to having authentic Black stories, Black conversations that, yes, may make other people uncomfortable, but holding space for real stories, that this is not a myth or just something that is being made up. It's real, it's measurable, and we actually collectively, I don't care what you look like or what your lived experience is, but we collectively can do something to change these numbers so that Black women are not dying.
Absolutely. And I just want to give a shout out to Speaker Joanna McClinton, who, because she's at the head of the House, has helped to make this a reality, for us to really push this to the forefront. She's always been super supportive. And also for the Pennsylvania Legislative Black Caucus that puts the forefront, since you're talking about Black stories, we are looking at health equity. We are looking at the things that really impact Black and brown folks in this Commonwealth to help to turn it around. So thank you so much for having me. And as always, we're going to just continue to do this work.
And this is a special moment for me as I wrap up. You and my close sister circle from the start of Living Strong. I posted this morning, and I didn't even think about it until I was literally writing the post, that we met at the launch of my business.
Yeah.
You sat across from me as I was wavering on whether or not I should get my book published. And you were like, yes. And not only, this is what we're going to do. And when we launched Flipside of Adversity, you said yes to be in the first episode.
Yes, I was in Florida, remember?
Yes.
So I was taking my son to school.
But you said yes. And it's such key moments and shifts in time, like true milestones in my story, you have said yes. And so thank you again for saying yes. We are literally getting ready to wrap up season 15.
Yay.
Season 15.
That's amazing.
And you said yes to me. You are saying yes to the state of Pennsylvania. And you are advocating, as you are saying yes, to the health and well-being of Black mothers. So I just say thank you.
Thank you.
Thank you. So we are going to continue with Black Stories, Black Conversations for all of June. And so I encourage you, stay connected, stay here, same place, same time, same conversations next week on the Flip Side. We'll see you then.